I'm Dr. David Hill, and today we're going to be talking about food remedies for sinus infections in babies. Now, when we talk about babies, I usually think about infants, that is, children who are 12 months old and younger. And the fact is that as far as what you feed an infant to keep them healthy, there's only one thing to say other than a good balanced diet with plenty of fruits and vegetables after age 6 months or age 4 to 6 months, depending on when you want to start. And that is to nurse, if at all possible. The one thing that we know can protect infants from quite a few different diseases, including sinus infections, is maternal breast milk. So nursing is the one thing that you can do that would be most important for protecting your baby from getting colds or sinus infections, which usually start as colds. Now, there are other good ideas for keeping a baby healthy with food, because a malnourished baby certainly is going to be more susceptible to disease. For 6 months of age, you're going to notice that your baby's probably getting pretty interested in what you're eating. And at some point, he or she is going to make a lunge for your dinner. And when you can't keep his or her hands out of your food, for gosh sake, put a little bit of rice cereal or even a little pureed fruits or vegetables on a spoon and see what happens. If it didn't all go down your baby's front, hey, you're good to start feeding. From there, you're going to want to progress to a diet that has some fruits and vegetables in it between 4 to 6 months and 9 months. And then after 9 months, we start suggesting introducing meat, although there are some sources that say you can do that earlier or even should do that earlier. So certainly you want to make sure that your baby's well fed in general. Now, if you have worries about your baby's nutritional status, check with his or her doctor. They should be keeping track of length, weight, and head circumference, and should have charts they can show you to show you how well your baby's growing. So, a healthy, well-fed, growing baby should do great with a widely varied diet in terms of avoiding colds and sinus infections. But most importantly, if nursing is an option for you, do try it and keep it up at least to 12 months of age if you possibly can. Talking about what to feed your baby to treat or prevent sinus infections, I'm Dr. David Hill.